Hello, good evening. It is 7 o'clock on Tuesday night, I believe. I hope, because if it is, then I'm in the right place. If it's not, then I'm not. But I am, aren't I? It's Tuesday, definitely. So it's me, Jonathan Stiano, consultant plastic surgeon, live Q&A. If you've got any questions, ask me live by all means. I've got a list of questions here already that I'm going to go through. And if you could do your bit and comment and share, that'd be great. As ever, always very. Oh, look, we got straight in. Look at that, Olivia. I saw that already. My friend's mum woke up during surgery. Dear God, don't wish that on me. Thanks, Olivia. That's a question I've got in my list. Waking up during surgery. If you are a podcast type person, this is a podcast every week on iTunes. This becomes a podcast. And if you're a video type guy, then this also goes on to Facebook. It is on Facebook now, isn't it? YouTube. So please subscribe if you're if you're of that sort of ilk. So what do we got? Oh God, what's going on here? Something's kicking off. It's kicking off already. Irene straight in with a kickoff. Irene, look at you. Irene's got a question about breast implants. I want to lose a stone in weight. Will this make my breasts look smaller, or will they look bigger on a smaller frame once I have lost weight? Thanks in advance. Great question, Irene. Great question. Kicking off the Facebook Live tonight. Irene's out the gate. I always say to people, if you want to lose weight, then do that first before having any sort of contouring surgery, particularly having breast implants. And the reason for that is, first of all, it will have an unpredictable effect on your breasts. Some people, a breast is made up of fatty tissue and it's made up of glandular tissue. And you can't tell by looking at the breast how much fatty tissue and how much glandular tissue is there. If the breast is made up of a lot of fatty tissue, then it will respond to weight changes. I.e., if you put on weight, it all goes on your breast. If you lose weight, it all comes off your breast. Some people say that, when my weight fluctuations, it all goes on my breast. But if your breast is made up of predominantly glandular tissue, then it may not be affected by weight changes. Sometimes I lose weight and none of it comes off my breast. So it's unpredictable. We can't really predict what's going to happen to the size of your breasts with weight change because it's unpredictable. It's I hope this is all right. Because it's unpredictable, it means that you should do it before having breast implants, because you don't want to do things to your you don't want to get the right size of breast and then you lose weight afterwards and maybe lose volume in it. Or you don't want to say, I'm going to lose weight, so I'll have a bigger implant because I'm going to lose weight and breasts can get smaller, and then they don't. So it's always best to lose weight first, whatever you're having. The other reason to lose weight first, particularly in terms of breast implants, is because one of the things we think about when we're putting breast implants in is whether we're going to put it in front or behind the muscle. And when you put it in front or behind the muscle, then that depends on how much subcutaneous covering you've got over your chest. And so the more covering you've got, the more likely you're going to put it on top of the muscle. So it might be the case where you make the judgment to say, look, I'm going to put it under the muscle because you've got enough covering, and then you lose weight and you lose that covering, and then all of a sudden you can see the edges of the implant, or you get rippling because you've lost weight after having the implants. And so if you'd lost weight first, it might have been that you would have had them under the muscle. So a couple of reasons there that you should lose weight first. And it's difficult to say whether your breasts. I don't think you're saying, will they look bigger on a smaller frame once you've lost weight? I don't think that's so much the case, but it may well be that your breasts will get smaller if you lost weight. So they might look smaller when you lose weight. They might also droop a bit if you lose weight. So, the shape can change. So maybe the shape of the implant might change. You might have a different shaped implant if you lost weight first. So a few reasons there to lose weight first, Irene, I would say. So good luck with that. And CC Char, Triple C. Sorry, hi, how much for a tummy tuck? I'm 1410. 1410. So what could I go down to? I'm 1410. How much for a tummy tuck? CCC. I don't know off the top of my head. I can send you a quote, or you can direct message me, and we'll tell you how much it is. I think it's quite an expensive operation, CC. It's probably sort of, I don't know, £7,000 or something like that. I'm not sure what it is actually. I shouldn't think of numbers because I'm not exactly sure. But it's several, more than £5,000. Put it like that. For a full tummy tuck. But if you direct message us, we'll send you. Got an email where we send out all this information and stuff. And I'm 1410. What could I go down to? Straight back in. Fiona, I'm not. I know I've leaped yours. How much are you losing? I mean, how much weight are you losing? Is it how much weight are you losing when you have a tummy tuck? How much for a tummy tuck? I don't know if you can hear this noise in the background. There's guinea pigs in the office. We're looking after some guinea pigs for some friends, so I'm not sure if you can hear that. So I apologise. I think they're fighting. Well, Cece, it's not really a weight loss thing. So, but nevertheless, you do lose weight. Obviously, there is weight in the bit that you take off when you do a tummy tuck. It varies on how big you are before. So obviously, the bigger you are before, the bigger the bit that comes off. So it might be 500-600 grams. It might be a kilo. It might be 3 kilos. It might be 5 kilos. It depends on how much weight you've got there. So I would say average is about 800 grams to a kilo, sort of average. But sometimes it's 2 or 3 kilos if it's a big one. Depends on how much is there, really. But it's not, as I said, it's not really weight loss. The idea of tummy tuck is it's after you've lost weight rather than being a weight loss thing. Fiona Ell, does having Ehlers Danlos syndrome impact surgery? I'm sure someone asked about this before, and I don't think it was you, Fiona. So Ehlers Danlos is skin elasticity. So you have hyperelastic skin, and yes, it will impact surgery, Fiona, for a couple of reasons. Your wound healing might be affected in that your wound healing might be delayed. You might have more problems with wound healing, and also because you've got hyperelastic skin, then it's more difficult to get it to be tight because your skin is sort of very elastic. So it might affect your result. And if you are looked after by someone, if your Ehlers Danlos is looked after by somebody, then we'd probably talk to them just to see if there's anything we can do to maximize your situation. But if not, we just say, look, it might affect your ability to wound heal, but you might say, well, just maybe weigh into the balance of having surgery or not. So that might be an issue. CC, yes, thank you. CC, thank you for asking the question. Irene, thank you for getting out the gate and getting in there. That's excellent. Would it affect correction of a diastasis even at those deeper levels? It is Ehlers Danlos is a collagen disorder. I don't think. I mean, the correction of the diastasis. That's the for those who don't know what the diastasis is. It's the rectus muscles, the six packs. They can be a little bit splayed apart, and part of a tummy tuck is to bring those rectus muscles together. Would a Ehlers Danlos? I don't think so. I mean, I've spoken before about using a sort of permanent or long-term dissolvable suture to bring the to bring the diastasis together. So I don't think it would affect that. I don't know what you mean. Whether it affect it less likely of it healing together or more likely of it stretching afterwards. I think your diastasis would be okay. I would be more personally. I'd be more worried about the skin healing. I've got to say, Fiona, I haven't got a huge experience of people with Ehlers Danlos, but that would be my worry. Would be the wound healing more than the diastasis repair. That's where I would be at. But again, I'd probably talk to your if you are being looked after, if you have got a doctor looking after your Ehlers Danlos, I'd probably talk to them and just check that if they've got a view on it. So I need to have some Lego figures on my desk, which is good. You're very welcome, Fiona. I hope that's okay. Jane, I've recently had a tummy tuck. I'm currently 12 stone. Would I really like to go down to 11 stone would this dramatically affect my results for my tummy tuck? So, Jayne, if you've already had the tummy tuck, I think it is good to lose weight, because I think losing weight is a good thing to do, and you want to be comfortable and you want to be happy with your weight. If you said that to me before you had the tummy tuck, I'd probably said, well, I would have said, just like I said for the breast implants, it's better to lose weight first. The reason you need a tummy tuck is because there's too much skin there. And one of the reasons people need a tummy tuck is if they've lost a lot of weight, because the skin doesn't recoil so well. So one of the worries about losing weight is you can get a bit of redundant skin there. And certainly people who've lost a huge amount of weight sometimes put a bit of weight back on to fill the skin. That is the worry. If you've had a tummy tuck, when we do the tummy tuck, we make it as tight as we possibly can. If you then lost weight, we might have been able to make it tighter if you'd lost the weight first, but that doesn't help you because you've already had it. So what I would say is carry on losing weight, and just see what happens. It might be that your skin will recoil and you'll be fine, but it might be that it will affect the result. I don't know if it will dramatically affect the result. I hope not. But I think it's good to lose weight and be comfortable with your weight. Thank you, Jan. Hello, good to see you. Helen, I'm listening out for the above question. Can polyurethane cause a reaction? Yeah, Helen, thank you. It's on the list. It's number 2. It's number 2 of the list. So number 1 of the list is, what is a Brazilian tummy tuck? Hi, JJ. On the live on Tuesday, can you please talk about the Brazilian tummy tuck? What it is, how it differs from a normal tummy tuck, and whether it's safe, and your opinion of it, please. Yes. Okay. Well, my opinion of a Brazilian tummy tuck is, it's something that, to be honest, I've had to. It's not something that I've seen much in the medical world. It's something more in the sort of online world of people talking about it and using the term. Now, I'm a big fan of using terms for things. We have a thing where we have a buddy scheme, where we, patients thinking of having surgery, we put them in touch with someone who's already had the surgery. We have a satisfaction guarantee where we refund the consultation fee if we haven't been helpful. So I'm a big fan of giving things names. Say we got our, eternally grateful if you have surgery with us. You will see your friend without charging a consultation fee. Giving names to stuff, and this is, and it's sort of marketing, really. Giving names to things, sort of the buddy scheme, put you in touch with someone who's previously had surgery. I think a lot of doctors would do that, to be honest with you. They may not call it the buddy scheme, they do it anyway. But it's a bit like, oh wow, they have a buddy scheme, that sounds really good. And in a way you could call that marketing, or it's just letting people know what we do. For me, I think this Brazilian tummy tuck, from what I can see of it, is a little bit marketing, really. I look at what people say it is, and one of the things they talk about is limited undermining. When you do a tummy tuck, you have to undermine all the way up to the rib cage, and they talk about just making a tunnel above the rectus muscles so you can repair the rectus muscles. I've been doing that for as long as I can remember, making that tunnel. I've been doing it for like 10 years. I haven't. So when I see people talk about it, they say, oh, normally a tummy tuck, you widely undermine all the upper skin flap, you widely undermine it to the sides. I've never widely undermined it to the sides. I've only created a little tunnel century so that you can pull that down, and you have to undermine a tunnel century in order to repair the rectus muscles. And so does that mean I've been doing a Brazilian tummy tuck all this time? Like, I don't know. So that's one thing that they say that it does, as opposed to a normal tummy tuck. But in my experience, a normal tummy tuck, you don't widely undermine. It's very old-fashioned to widely undermine. I don't think people have been widely undermining for a long time. I don't know. Maybe people are widely undermining. But the other thing they talk about is liposuction. It's, again, going about the marketing thing, liposculpture. People like this word, liposculpture, instead of liposuction. It's still sticking a bit of metal in which sucks fat out. You can call it liposculpture. Okay, sculpturing the fat, sucking the fat to sculpt it. Liposucking, and they often they're talking about liposucking the whole abdomen, so liposucking the upper fat. And that is not something that I do. So that is, I guess, something different about a Brazilian tummy tuck if they are liposucking the upper flap. and that is something traditionally we've often been worried about. There's a question later about thinning that upper flap. We were always worried about the blood supply of that upper flap. Now they're saying because they're limiting the undermining, they can still do liposuction to the upper flap without affecting the blood supply and get good healing. It's one of those things where I think if people have got good experience of that and it works, then that's fine. Personally, I don't liposuck that upper flap. I liposuck to the sides. So they're talking about liposuctioning sucking the whole abdomen. So combining a tummy tuck with liposuction again is something that's been around for many years. It's not anything particularly new. So it's just sort of giving a name to a combination of procedures that maybe a lot of people are doing anyway. Limited undermining and liposucking to contour the flanks and the hips is something that certainly I've been doing for a long time. The difference is I don't liposuck the upper flap, which might be something that could distinguish it. So that is something that could distinguish it, but the rest of it is I'm not seeing an awful lot of things to differentiate it from a normal tummy tuck. Whether it's safe in your opinion, well, I wouldn't do it. I wouldn't liposuck the upper flap, but then maybe I'm just conservative. One of the things about plastic surgery is that you need people to sort of push the boundaries. If you're always safe, then maybe you're not doing enough. So, but the problem with people pushing the boundaries, then they might get wound healing problems. But it's good that people are pushing the boundaries, and it might be that it will become standard to liposuck the upper flap if these people can show that it's deemed to be safe. But I'm not one of them. I'm one of the I'm not the flag bearer at the front to check whether it's all okay. I'm doing the sort of thing that we've been doing for a long time, which is not liposucking the upper flap. So maybe it'll in time become acceptable, but I don't do it. The other thing I think they talk about is you're not using drains because of the limited undermining. Again, as I say, I've been using limited undermining and quilting sutures for a long time. I still do use drains. I just worry about seroma. It's not a big deal, seroma, but it's a bit of a nuisance, and it's not something I really see. So, it's like I don't really want to, even if it's a small risk of seroma, I'd rather not have that. And again, normal tummy tuck, people doing normal tummy tucks have not been using drains for quite a while now. So I don't really see it as a tangible difference in the tummy tuck world. I think people are often looking for, I do this technique, which is totally different to everybody else. First of all, if that's the case, you've got to think, why does no one else do it if it's so great? And secondly, you might come around and think, actually, it's not widely different to whatever else is doing. It's a bit like vaser liposuction. Sometimes it's touted as being something wildly different that can get wildly different results, when in fact, when you're in it and you look at it, it's sort of not that different, the results you can get compared to traditional sort of power assisted liposuction. So I think for me, it's a bit of a name thing, but that's because it's not a name that I tout about that I do it. Maybe I should say I do a Brazilian tummy tuck, because I do the narrow undermining and sculpt the hips and the flanks. But that's what it is for me. I'm not big on it, but some people are. So yeah, do your research, look at the results of the surgeon, and if they're good, then go for it. What's going on in this chat box then? Jayne Alison, that's great. Thank you. You're welcome, Jayne. Oh, that was, good luck with that. Yeah, lose weight first. Lose weight now, Jayne, and I hope you'll be fine. Sharon Jackson, Fiona Ell, I'm 7 weeks post-op. Scar healing is an issue and end results are possibly not the same. Feel free to PM me. Sharon Jackson Loma, are you the one who asked before? Right, there you go. Look at that. Connecting people. Yeah, that's what we're doing. We're bringing people together. Ehlers Danlos. Good on you, Sharon. Thanks for that. Sharon's got some input of a real life person. Irene, what results can liposuction have for the stomach, please? Thanks, Irene. Good question. In my hands, I don't really like doing liposuction to the stomach, not to the anterior, to the front of the stomach. A lot of people ask for it, and the reason I don't like doing it is because it doesn't cause skin retraction, and therefore I worry that, as I say, people need a tummy tuck because they've lost weight because the skin doesn't retract. Now, if you do liposuction, that's sort of like losing weight. You're taking fat away. But if you're taking fat away but not skin, you worry that you'd be left with redundant skin. So it's good for a little bit of excess in the upper abdomen. So it's, very select cases in my hands for a little bit of excess fat, a little bit of residual pocket of fat. Liposuction might help contour that. but to get any significant contouring of the abdomen, I worry that it will not cause skin retraction. That is where the VASA comes in, because VASA, they do say, causes some degree of skin retraction. Also, these non-surgical ones like cool sculpting and shouldn't use trademarks, fat freezing, should we say, whatever, or fat, radio frequency, all these non-surgical types of liposuction do say that they cause some degree of skin retraction. That's why I was very interested in it. I was very interested to get one in the clinic, because I think, oh, that'd be great. A great group of patients that I can't really treat particularly well at the moment. If it does work, then that's great. For me, it's got quite subtle results from what I've seen, but again, it is something that they report that it causes. And if I could find one that really had a dramatic result, I would get it. So yeah, that's where I am. I'm a bit on the fence with liposuction to the stomach, and it's just for selected cases. But it's I think we still got to crack that, and I think we haven't really cracked it from in my experience of the non-surgical things. And as I say, I don't really know if the VASA does that. Oh my god, that's my mum. Sorry, I'll call her back. Oh gosh, turn the sound off. So I don't really know if that causes skin retraction or not, but that's the worry with liposuction to the stomach. I think it's good for a little bit of the upper abdomen, but not if it's a lot of fullness there. The best way to contour the stomach is with a tummy tuck. But I understand there's a lot of people who aren't ready for a tummy tuck and who just want a bit of tightening. Khan's late. Don't worry, Khan, you haven't missed anything. Sharon, yes, that's with the connecting, I think. All right, voicemail. Right, there we go. Here we go. Who was waiting for this? Helen. There you go, Helen. The fact I have, this is a patient of mine who is considering she's booked for surgery. So she's booked for surgery and she's thinking of having polyurethane implants, and she's asked this question. The fact, oh, God, Mum's reading the landline now. The fact I have sensitive skin, I'm prone to reactions and flare-ups of everyday products on my skin externally. Would this increase the chances of my body reacting to polyurethane implants internally? So hopefully that's been picked up. Message anyway. So yes, polyurethane implants. So yes, you can get a reaction to polyurethane implants. It's very rare and it's like a rash on the skin, and I've only seen it once many years ago, but it is reported. It's some kind of reaction to the foam. I don't really know what it is, and it causes a rash. It's treated with antihistamines, and it's self-limiting in that it gets better on its own. And it's nothing really to worry about. The only slight worry about it is that when someone has just had breast implants and they phone you to say it's gone all red and it looks all angry, you worry about infection. So when I had it, I thought, well, that doesn't look like infection. It looks a lot more like a rash, and I knew that polyurethane implants could cause a rash. So I treated with antihistamines, but also treated with antibiotics to cover infection. But it did get better on its own, and it was never really red and angry and tender like infection was. So it's not a problem, the rash that you get with polyurethane, but it's out there, but I wouldn't necessarily think it should put you off polyurethane. This particular patient is thinking having a teardrop implant. One of the good things about polyurethane is they don't move. So she's now thinking of going to teardrop silicone, which is fine, and she can go teardrop silicone, no problem at all. They have more risk of rotation, but if she's worried about this, then that's fine. She then went on to email and say, well, I'm worried that the implant's going to have to be removed if I get a reaction, and I can't remember how she put it now, but it's sort of like my body rejects the implant. A lot of people talk like that and say, oh, my body rejected the implant. Now, what she's talking about there, a lot of people talk about bodies or them rejecting the implant, or they had a reaction to the implant and had to have it removed. Now, whenever people talk like that, really, they're talking about infection, really, because infection is not that common, but it's certainly a lot more common than having some kind of reaction to these implants, because they're pretty inert, these implants. But they are a foreign body. They haven't got a blood supply. And so you can get you can get an infection anytime you do surgery. But if you do surgery where you put a foreign body in there, where you put a piece of silicone or a silicone covered in polyurethane, then that can get infected, whether it's polyurethane or not. So this is not just polyurethane implants. This is silicone implants as well. This is saline implants. This is hip implants. This is heart implants. Any implant you put in the body, if you get infection, that's why we're very meticulous about infection when we're doing implant surgery, because if you get any bugs on that implant when it's inside your body, when you treat it with antibiotics, you treat infections with antibiotics, that's fine. And the antibiotics go in your bloodstream, they kill the infection, fine, no problem. But if there's infection, if there's bugs on the implant, on the foreign body doesn't have a blood supply. So it just never settles. It grumbles on, it gets red and angry. Sometimes with breast implants, the wound can open up, the implant can be visible, and you think it's your body rejecting the implant. It's not, it's just an infection. And indeed, you do have to have that implant removed. Once the implant's removed, fine, the infection settles pretty quickly. You have to leave it out for a few months and then put another implant back in again. But that's a risk with any implant, not particularly with polyurethane. So that's not really the reaction to polyurethane. That's a risk when you're having implant surgery. So it's not specific for polyurethane, but it's something that can happen with any implant. So I hope that's covered that. Make a way up during surgery and not be able to move. So here we go. Have you ever had anyone tell you they woke up in surgery? I've read online that it can happen and your body is unable to move, but your brain is aware and can cause PTSD if it does happen. Can you make sure I'm dosed up enough to stay asleep? Right. Now, and also, Olivia's come in saying that my friend's mum woke up during surgery. Dear God, wouldn't wish that on me. So that's a real life example there. Right. Okay. Well, I've never seen it happen. And I've never been around or spoken to anyone who that has happened to. I have seen it on telly, but I've never seen it in real life. The reason that it's very unlikely to happen is that you are monitored during your surgery. You're monitored, your observations are being monitored, your pulse and your blood pressure are being monitored continuously. So if there's any evidence that your anesthetic is becoming lighter, you're beginning to wake up, you're getting light with your anesthetic, your pulse will go up and your blood pressure will go up, because that demonstrates you're feeling pain. If there's any evidence that the anaesthetist will be monitoring this, and if there's any evidence that you're feeling pain, if your pulse rate starts to rise, which will be the first indicator that you're starting to feel pain, then he'll give you more anesthetic. So what you're describing there is very unlikely. And the thing about not being able to move is if you're paralyzed. Now, we don't usually paralyze you, but so you can see how it happens, because if you have muscle relaxants, you're paralyzed, and on paper it could happen, but the anaesthetist would have a warning that you are becoming lighter in your anesthetic by your observations. Your pulse and your blood pressure would rise, and it would be obvious that you're becoming lighter in your anesthetic. So I've never seen it happen, and I've never been around anyone who's it's ever happened to, and never spoken to anyone who's ever happened to. So as I say, on paper it's potential, but the anaesthetist would have to be pretty much not on the ball to miss that. And certainly all the anaesthetists that we work with are on the ball. And we can see the anesthetic monitors when we're doing the surgery, so we can see, and it goes beep. That's the machine that goes beep. It will go beep 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 beep. Your blood pressure will be going up. So yes, I can reassure you that won't happen, although Olivia's straight in there saying it did happen to her friend's mum. But I can reassure you that is very unlikely to happen, because we are on it and we make sure that sort of stuff doesn't happen, and you will be fine. Similar like when we do it under local and sedation. So some people aren't even under anesthetic, and we do it. And again, we monitor those things, the blood pressure and the pulse, to check people are comfortable and not in pain. And if it looks like they're in pain, then we give them more anesthetic or put them to sleep or whatever. But we make sure that you're not in pain when you're having the surgery, and pain is registered way before you're awake. your body will react to it before you're awake. Um, so, what is a safe alternative to a BBL? BBL? What's a BBL, you're saying? You don't know what a BBL is? You're not down with the kids like me. It's a Brazilian butt lift. BBL is frowned upon over here, and I wouldn't travel abroad. So, what is a safe alternative procedure for a better shaped bottom? Well, um, yeah, I mean BBL is a couple of, well, maybe more than a couple of years ago, a few years ago, it was a big thing, and there was all these guys from South America and everything coming over talking to us about these basically fat injections into the buttock, sucking fat out from somewhere, injecting into the buttock and making these big buttocks and buttock augmentation, saying how great it is. But then people started dying because the fat could accidentally be injected into these very large blood vessels that are in the buttock. And so in the UK, the BARPs and the BAPRAS, which are the plastic surgery associations, have said we shouldn't really be doing it. So that's sort of put the kibosh on that a bit. Now, I went to a meeting, was it last year? I think it was last year. And there's a guy from France, Francois Petit, and he gave a fantastic talk about about implants, buttock implants, which preceded the fat grafting. Buttock implants were like, you know, the initial way to do it, to augment the buttock using implants just like you do in a breast. And then they said, oh no, implants are terrible, they can dislocate, they can move, you're sitting them all the time, they're terrible, they're uncomfortable, you can get them infected, all these terrible things about them. And then they thought fat grafting is the new thing, and then implants went, and implants became very passe. Fat grafting was the new way of doing it. And then this has all kicked off with fat grafting. And he gave a talk last year saying, look, implants are great, look how easy they are. So what is a safe alternative? Well, you know what? I don't have an answer for that, because he made out as if implants were really great and really easy, and how many thousands of them he'd done and fantastic. And then he showed an operative. He did live surgery the next day, and to be honest with you, it wasn't. I thought, man, this is great. Put breast implants, you can put buttock implants in. Great, it's really easy. And you know what? It's like anything. Nothing's easy. It's not easy. I mean, this guy's done loads of them, and maybe he can do it safely. So maybe you need to go and see him. He's over in France, but I don't know. When he talked, I thought, great, let's start doing buttock implants at the clinic. But then when I saw the surgery, I thought, actually, you know what? You don't want to start meddling. You don't want to dabble in that. The problem with the buttock is there's lots of big blood vessels. There's lots of big nerves. There's a thing called the sciatic nerve. It's about that big. It's huge, and it supplies your leg, basically how your leg moves, and it's right in this area where these muscles are, and so there's potential for issues. Also, you're sitting on them all the time, so it's just uncomfortable to sit on. You've got to not be on it for a while. So I haven't got an answer for that, what the safe alternative for buttock augmentation is. But fat grafting's out. Implants are an option if you can find someone with experience of implants. I don't know anyone in this country who has got experience of implants. There may be someone, but I don't know who they are. But you need someone experienced in the procedure, really. And in this country, we're not. We're just not. I don't know anyone who's got a big series. There might be someone, but it is a bit of a worry, and I haven't got an answer for that. I'm sorry about that. I don't know what, because there's obviously a demand for it. You talk to the people, these guys from South America and these guys from Europe who are doing it. They're doing a lot of it. So there's a big demand for it, no question. But it's just safe. Safe is the key thing. And I think in this country we are very wary of that. Patient safety is paramount, and if your safety is a concern, we just don't do it. Vilma Santos. You don't want to mess with Vilma Santos. Vilma Santos. That is a name. God, sounds like something out of I don't know, some cartel or something. Anyway, is that possible to remove natural BB? Natural BB. What's natural BB? Natural Brazilian butt? What's natural BB? Can you remove natural BB? Vilma, what's BB? Brazilian, like if you've got a big buttock, you mean? I'm just going to say that's what it is. Big buttocks. Yes, it is. I mean, removing a big buttock is easy. Well, nothing's easy, but it's certainly not as dangerous because you do liposuction, if that's what BB is. You can do liposuction to the buttock to contour it and to make it smaller. That is possible, Vilma. That is what you mean. Carry on, carry on. Smile and wave. Okay, what's involved in upper lip lift? Please, can you talk about upper lip lift? What's involved, and does it take away the need for fillers? Well, yes, I can talk about what's so an upper lip lift is. I can't demonstrate, can I? I haven't got a lip. Well, I have got a lip. So basically, your lip is this bit here, the pink bit. You know, your bit you put lipstick on. And what an upper lip lift is it lifts your lip by removing some skin from your nose, from just below your nose, and shortening the distance from your nose to your lip. So you get a scar at the base of your nose, so it's pretty well hidden. I don't do this. Full disclosure, I don't do this. Kuram Khan does faces at the clinic, so he'll be the guy for this sort of thing. But it removes the distance between your this distance here from your nose to your lip, and so it brings your lip. Oh, I demonstrate that. Oh no, I'm not demonstrating that very well, am I? Does that look aesthetically pleasing? No, it doesn't, does it? Hello. Well, my lip definitely looks fuller, doesn't it? Well, I've had my upper lip lift. So that's basically what an upper lip lift does. It lifts your lip, so it makes the actual pink bit of your lip look fuller. I think I've demonstrated that quite well. Quite happy with that. Before, after. So that's now you know why I don't do upper lip lifts. I'm not really anyway, that's what it does. So does it take away the need for fillers? Yes. So it's not doesn't you don't have fillers, it's just your natural lip is lifted. I mean, you could have fillers as well, but the point of a lip lift does not involve fillers. It removes taking skin away from beneath your nose and lifting and shortening the distance from your nose to your lip and bringing your lip up from one lip to another lip. So it's labiaplasty time. What is a recovery time and how long after you can have sex? Fair dues, fair dues. Again, I don't do labiaplasty, but we do it at the clinic. So recovery time. So it's it's not that big an operation in terms of what is done. The wound is often not under that much tension, so the wound usually heals pretty well, but it is a sort of naturally sort of hot crevicey sort of area, so there is a potential for wound healing problems. So you'd hope the wound's going to be healed in a week, call it maybe 2, just to be sure, because it's not a great area for wound healing. The beauty is that the scars are sort of hidden, but they can take a little bit longer. So we're talking about 1 or 2 weeks to get the wounds healed, and it will be a bit sore, a bit bruised, a bit swollen for those first couple of weeks, and then after that you'll be feeling better after the first couple of weeks. But it's going to take a few weeks for that scar to sort of settle down and to soften. How long after you can have sex? Oh God, gently, piano. Oh geez, 6 weeks, maybe 6 weeks. Take it easy, go slow on it. I don't know. I'm going to say 6 weeks, a month, 6 weeks, something like that. Depends on how it all heals, but it usually heals pretty well, to be honest with you. So you usually heal in a week or 2. So by sort of 4 to 6 weeks, you should be all right to get going with a bit of movement in the area, hopefully. So as long as it all heals up all right. It varies from people to people. Obviously, some people have problems with healing, some don't. That's assuming you don't have any problems with healing. Right, let's move on. Get back onto familiar territory. Right, okay. Whew, right. I didn't expect that on the Facebook Live, did we? Right. I have a mole on my face and I have had it most of my life. It's recently started to look a bit bigger. At what point should I start worrying? Can you hear the dog at the door now? The dog's after the guinea pigs. Oh God, it's all kicking off. So you know what? The thing about moles is if it changes, even if you've had it all your life, it's if you're saying it's recently started to look a bit bigger, Now's the, I wouldn't say what point should I start worrying? I think now's the time to get it checked out. It's pretty easy these days. Get your GP. Go and see your GP. Your GP will be happy to check it out. We do free mole checks. You can come to the clinic. You don't have to pay any money. Come and see one of the consultant plastic surgeons. We'll have a look at your mole. Just just get it checked out. If it's changed, get it checked out. It doesn't mean it's bad. It doesn't mean anything bad's happened to it. I've got this guide that you can get on the website. Things to when should you worry about your mole? And you look for things like bleeding, itching, changing color, bigger, smaller, darker, lighter, halo around it, things like that. Any of those things don't necessarily mean it's cancer. It just means you got to get checked out. So if it's getting bigger, it doesn't necessarily mean it's cancer. So don't worry so much about it. But it's just so easy to get it checked out in this day and age and in this society. We've got great healthcare. Just get it checked out. Go for it. Why not? There's no harm. Because what we're talking about here, when moles can go bad, is a type of melanoma. Really, worst case, it's a type of skin cancer. And it's a bad thing. Melanoma is a bad thing. So it's just so easy to access a doctor now these days to get your moles checked. I would say now is the time to get it checked out. Not necessarily to worry about it, but to get it checked out. So get it checked out. Oh, Vilma's back on. Oh, his belly. Is it possible to? Is it belly button? Is a BB belly button? Is it possible to remove a natural belly button? Of course it is, Vilma. Why would you want to remove your belly button? But you can, yeah. Yeah. Just you'd end up with a scar. Cut it out and have a scar there. If BB is belly button, then yes, it is possible to remove a natural BB, but you'd have a scar where the belly button was. And let's face it, the belly button is a scar anyway. It's a scar from the umbilical cord, but it wouldn't be dented in scar like what a belly button is. You could have a flat scar if you wanted. Can't imagine why anyone would want to have their belly button removed. If you don't like it, you could have it remade. You have a new belly button made. Is this? We got a belly? Yes, we have. We've got a belly button. Vilma, you're in luck. We've got a belly button question coming up. Here we go. It's not this one. It's the next one. One after this one. I'm 6 months post-op from tummy tuck. It's not how I expect it to look. I've still got quite a lot of skin and the Mons area is big. My surgeon is asking me to wait 12 months but has a 7 months revision policy. Is this something that is considered revision? Oh, saucy. So I hate these revision things. I hate it when the hospitals have a revision policy of a certain amount of time because often things will settle. So what I would say is things. This is what I say to people. First thing I'd say is go with whatever your surgeon says. This is just full disclaimer. This is my opinion. I would do whatever your surgeon says. But in my opinion, I think that things start to settle around 3 months. And they can take 6, 12, 18 months for them to fully settle. So you're now 6 months. You're just in the middle of it, really. You're just in the middle of it. You're not fully settled yet. So I can totally understand why your surgeon wants to wait for 12 months. My view, and again, full disclosure, just my view, it depends on how bad the problem is as to when you do the revision. If the problem's really bad, and you think even in 12 months, I don't think this is going to settle, you're probably going to do the revision a bit sooner. You want to wait at least 3 months because the tissues are really hard and really hard to operate on before 3 months. So you really want to do any revision before three months. But if it's something really bad, you might sort of operate on a bit earlier, around six months, because you want to get a happier patient quicker. Most of us want to get a happier patient quicker because we want our patient to look back and think, oh yeah, I had a bit of a problem, but they sorted it out really quickly and they're really good surgeons and we're really happy with their results. So I think most surgeons do want to get things sorted out quicker. But if it's not that bad, things will settle. You'd be surprised at how the result changes in the first 12, 18 months. And I think people often don't realize that because 6 months sounds like, well, it is a long time from the surgery, but there's still things that you're going to settle. So I can totally understand why your surgeon's asking you to wait 12 months. I mean, ideally, I would say it is reasonable to wait 12 months, as long as it's not like way off. If it's way off, you don't want to have someone waiting 12 months with looking all weird. If you can fix it sooner, God, scare the life out of me, then do fix it sooner. But I can totally understand why your surgeon's saying that. Now, the problem comes with this revision policy thing, because often the revision policy is implemented by the hospital. And so, and I think for me, I think it's a false economy, because if you've got a revision policy of 7 months, a lot of patients are going to say, look, I'm not going to pay for it. I'd rather have it done. Just do it now. And the surgeons say, yeah, but you might not need it done. Yeah, but if I do need it done, I'm going to pay thousands of pounds in 3 months' time. I want it done now. So I think it's a false economy, because I think the hospital's going to end up doing more revisions with the policy. So what I normally do, and again, this is just me, but you can maybe ask your surgeon to do this, is I put a revision request in within the 7 month period, or whatever the period is, within the period is, and I say, look, there's a revision request. Can we get this revision agreed? The patient's going to come back in 6 months' time, and if it's settled, then fine, we won't need it. But if it isn't, can we do it then, rather than doing it now? So get the revision approved within the revision policy time, and just say to the hospital, look, if you say no, the patient's going to have it done now anyway. Whereas if you agree, the patient might not need the revision if we wait 6 months. That's how I would frame it. But there's nothing worse than, and this is why you need to have this conversation now, because you're within the 7 months. There's nothing worse than waiting to 12 months, needing the revision, which you felt you needed at 6 months, and then being charged for it. That's what, there's nothing worse. Obviously, there's worse stuff than that, but that's a pretty bad thing. I think we'd all agree on that. But you need to have the discussion now, and it's good that you're having this discussion now, and it's good that you know about the 7 month thing. And I say I hate it. I'd much rather a longer revision policy. I'm sure you'd end up doing less if the revision policy was longer, in my view. The Parkway, it's a year, and I think a year is good. A year is reasonable for things to settle. So yeah. Here we go. Tummy the BB question. We've got a BB question here. Can I have my belly button, BB that is, obviously, revised after a TT? Can I have my BB revised after a TT? If you don't like your belly button after your tummy tuck, can you have a revision? I don't like mine. It doesn't look natural and has obvious scarring around it. Yeah, this comes down to scar revision. This is a scar revision question. And the answer is scar revision is more difficult than you think. This plastic surgery malarkey is not as easy as you think. A lot of people think these plastic surgeons, they're brilliant, they're fantastic, they get rid of scars and they're brilliant, they give you a brilliant belly button, and they'll fix it. But if you've already got a scar that you don't like, you've got to think, how can we make that scar better? How can we check? I mean, we're going to give you a scar. I mean, everyone who has a full tummy tuck has a scar around the belly button, but you just got to try and make it as good as you can. And so how can you make that scar better? So it is difficult, I'll say that. So first thing, time, leave it time for it to soften, the scar to fade. And then what is it about the scar you don't like? What's the problem? Is the scar on the abdominal skin invisible? Is it too big? Is it too small? Is your belly button too big? Is your belly button too small? Is it scar raised and firm? A sort of hypertrophic scar? What is the problem, to see whether there's something we can do to make the problem better, because we don't want to just cut it out and give you a new scar and then the same thing happen again. What we try and do is try and hide the scar on the inside. So bring the abdominal skin over into the sort of mouth of the crater, if you like, so that there's no scar on the outside. So you try and hide the scar sort of in the belly button a bit. But if you're having a revision and you're doing that, then that involves sort of cutting some skin off the belly button to make the stalk of the belly button shorter, so that the scar sort of dives in a bit. But then that potentially makes the scar a bit smaller. And one of the risks of belly button scars is they can... Sorry, the guinea pigs are having a fight. One of the risks of belly buttons problems is that it becomes sort of stenosed. It tightens down. So obviously, if you're making it smaller, then that's a risk of giving you a different problem. Now you can see the scar. Okay, I'll fix it, and you make the belly button too small, then, and it stenoses down. That's a more difficult problem to correct. Make a belly button bigger is difficult. Making it smaller is easy. Making it bigger is difficult. The problem is usually that they're too small. So if it's too big, it's pretty easy to make it smaller. You can just put a purse string and make it smaller. So it depends on what the issue is as to whether it can be revised. But you know what? We've got a few tricks up our sleeves. There's often things we can do to fix things. So yeah, go and see his plastic surgeon and see what they can do. They might be able to do something to make it better. Can you explain the recovery process for a TT with an arm lift? I've got a question, JJ. Heavy lifting after tummy tuck and arm lift combined surgery. What are the limitations? 3/4 weeks. How is bending? I know I should possibly take 6 weeks off as I live in my live-in carer job. I've got a carer job basically, but I'm thinking of the money, no work, no pay. So the climate I'm at now, for example, helping her to dress, bit of bending at lower end, but not lifting. Will I be safe to do that? Really tricky this, and it's often the way. And I understand if you're having this surgery, it costs a lot of money, so you have to go back to work in order to pay for the surgery. And we're saying, oh, take all this time off work, but a tummy tuck and an arm lift, that's a big combo. That's a big combo right there. Tummy tuck, oh, flipping egg, arm lift every time you move your arms. It's a big combo, no question about that. So 3 or 4 weeks post-op is early days. Is early days. So I would be saying, and you're a carer. So that's, again, stick with your surgeon, do what your surgeon says. But I think 3 or 4 weeks is a bit soon to be doing carer job, really, of a tummy tuck and an arm lift, because those wounds are under tension. That's the point of the surgery. You close those wounds under tension. They're tight and they just wanting to open up. So you go doing stuff, you're going to more likely put tension on those wounds and potentially get problems with the wound healing. So for me, 3 to 4 weeks is a bit early for that combination of procedures. It's a big combo, and I think 6 to 8 weeks I'm reckoning before you're going to do anything too heavy, and even then gently. It sounds like you're trying to go gentle on it, and I understand you've got to work and you've got to be paid, but I think, and you might be all right. I think your worst case, no, sorry, best case, it might swell a bit and might take a bit longer to settle. You might say, look, I can accept that because I've got to get paid. But, I think the recovery would be better if you could take it easier and just do less um, physical work, maybe for another few weeks. But I understand you're a carer, so maybe you can't do less physical work. But that's a tricky one. Obviously, talk to your surgeon. Depends on how well you've healed, how everything's going this far, because you're 3 or 4 weeks in, so you've probably got an idea how far in you are, or how well healed you are. And talk to your surgeon. If you have to do it, then what can I say? My advice would probably be not to, but you've got to earn money. So, if you do, take it easy. If it swells up, if it's painful, back off. Tricky one, that one. Tricky one. What we got? What we got? Liana Katarina. I'm 10 months post tummy tuck. I still can't run or do much that involves my stomach muscles without pain. Is this normal? I wouldn't say it's normal, Liana. I wouldn't say it's normal. I wouldn't say that people having a tummy tuck, I don't say to them in 10 months you can't run or do much that involves your stomach muscles. That in fact, I'd go so far to say that is not normal, Liana. Discomfort, yes. Weird feelings, tingling, numbness, pins and needles, yes. At 10 months, that is normal. After a tummy tuck, so it is normal to have discomfort. Discomfort's different than pain. Not being able to run. That sounds a bit. I mean, maybe it was closed very tightly. Are you massaging your scars and things, making your scars quite red and raised? Maybe you maybe massage them to help them to soften. Um, yeah, but having said that, Liana, it's a big op. A tummy tuck is a big op, and it can take a year or more for things to properly settle. So it might just be part of the healing. Again, talk to your surgeon, and your surgeon's probably been with you, or hopefully has been with you through the process, and will know how you're healing and how things are going, and hopefully things are starting to get better. You want to look at trends. Hopefully things are getting better. Might still be in pain, but you're better than you were 4 months ago, sort of thing. And in which case, that's a good thing. If things are getting worse, you think, hold on a minute, what's going on here? Is something happening? Have you got seroma? Have you got a collection? Is something happening? But if things are getting better, then you think, okay, well, maybe it's just taking a bit longer to settle. Everyone's different. So I think that is quite a long time, Liana. But torture surgeon is more like inside. So it's probably the muscle repair, which can be a bit uncomfortable. That rectus muscle repair can be a bit uncomfortable. And talk to your surgeon, work with your surgeon. If things are getting better, I'd be reassured. But yeah, it does sound like you're having a hard time there, Liana. 10 months is a lot of time for things to take to get better. So I'm sorry to hear that, Liana. I'm sorry to hear that you're still having pain at 10 months, but hopefully you'll turn the corner. Hey, just checking for your live tonight. Can you touch on rack removal? I think that's fat removal from upper tummy during tummy tuck by slicing fat off under skin. I sent video, but YouTube / Facebook wouldn't let me send to page. So I'm sorry I sent it to your personal page. A video for reference to what I mean. Thanks again. So I have actually seen this video. I did see it video. I didn't quite understand what you're referring to, but now I do. So this is a video of a surgeon. I don't know where he was. I think he's in America. And so basically, the upper flap of skin. So when you do a tummy tuck, you take out that sort of skin, all the skin and fat from the belly button down, and the skin from the belly button up gets pulled down. And one of the things we talk about, and I was talking about earlier with that Brazilian one, we don't do liposuction to the upper flap of skin because we worry about the blood supply. And what this surgeon was doing was taking some fat, thinning that upper flap of skin by taking some fat away. Now, there's a layer halfway through the fat called the scarpus fascia, and that's quite an important layer. So he was going below that scarpus fascia to try and keep some of the blood supply going to that skin, because the blood supply comes up and through the scarpus fascia. Okay, fine. I knew the desk was there. And also the scarpus fascia is important for closure. So he's trying to thin the skin below scarpus fascia. I don't do that. A couple of reasons. First of all, if you have got a huge amount of fat below scarpus fascia, maybe your skin flap is a bit thick in the upper abdomen. Maybe you weren't that good a candidate for abdominoplasty and you should have lost weight first, because it really, as I say, abdominoplasty is not really for overweight people. It's really for people who've lost weight first. And then that's when a tummy tuck comes in, because even though he's saying he's trying to keep it below scarpus fascia to improve the blood supply, I worry about thinning that flap, about reducing the blood supply to that flap. That is my worry. It's the same thing with the liposuction. I worry that by thinning that flap, I'm going to reduce the blood supply going to that piece of skin, and I'm going to reduce my chances of wound healing. So that's why I wouldn't do that, because I worry about that. Again, it's not common practice. There's a video on YouTube of a guy doing it in America. You've got to ask yourself, why is it not common practice if it's such a good thing to do? Because it sounds good, thin that flap, and that's fine. The other thing I say, in most of my patients, I don't find the need to thin that flap. They haven't got a huge amount of fullness in the upper abdomen, because when you pull it down, you stretch it, and it's not normally a big problem. Sometimes you have a bit underneath the rib cage, which you might need some liposuction later on. That's not uncommon, but thinning the flap probably wouldn't get that bit underneath the rib cage. You're thinning the flap sort of lower down on the flap, if that makes sense. So it's not something that I do. I can see how it would make sense when you watch the video. You might think, well, that's a good idea. Cut a big wedge of fat out of that flap to make it thinner, so it's a better contour. But it's all about the wound healing, which is a problem, or a potential problem, with tummy tuck. And I wouldn't want to do things to interrupt the blood supply to that skin flap to reduce my risks, to reduce my chances of it healing. So I wouldn't do that personally, but it sounds like a reasonable thing. As ever, if you've got a surgeon who's doing that and who's done it, loads of times, and it always does it, and it gets great results, and his patients are happy, then that sounds good. Then maybe that's good. Go with that. Go with, it's a bit like the implant thing. People worry about implants and makes of implants and stuff like that. I'm like, I think you should go with the surgeon that you trust. And I think there are different ways of doing things. You'll find some people will use drain, some people will use glue, some people will thin the flap, some people do liposuction, some people won't do liposuction, some people, it doesn't mean there's a right or wrong. It's just what we've come to become familiar with in our own practices, and we are always trying to give the best result to our patients, and I think you can get a really good result for your patients by doing things in slightly different ways. And I don't think that means it's right or wrong. So, it's useful to see what people are doing out there. And I'm like, well, I don't do that for these reasons, but he does do that. So, different strokes for different folks. Liana, thanks for answering. Thank you for asking, Liana. And I hope you get a bit of relief from your discomfort soon. So listen, guys, is the last question I'm on here. So if you've got any questions, get them in, my friends. Get them in. Last question. Come on. When can I have a breast reduction after having a baby? Hi, is there a certain period of time you have to wait after having a baby before you can have a breast reduction? Thank you. Yes, there is. So the thing about having a baby is when you have a baby, your breasts get bigger because they get engorged with milk. If you breastfeed, then they stay bigger for longer. And then when you finish breastfeeding, they get smaller again. And that process of the breast getting bigger and smaller can make them droop and what have you. So you really want to let everything settle before having a breast reduction. Having a breast reduction is having a lift as well. You do a lift as part of a breast reduction, and you really want things to stabilize in terms of the size and shape of your breasts before you have a breast reduction. You don't want to have a breast reduction and then your breasts to carry on getting smaller after you've had the breast reduction. So if you're still in the sort of involution phase, or the phase when your breasts are sort of recovering from having your baby, so that is really, I would say, 3 to 6 months. I'm saying minimum 6 months really before your breasts are really sort of starting to come back to normal. Depends on how long you breastfed for, and also depends on you. Everyone's different. So in the general terms, I think 6 months is sort of reasonable to start seeing where things are going to be coming back to. But the other thing you've got to think about is you've got a 6-month-old baby at home, and a breast reduction is quite a big deal. So you've got to think about how you're going to deal with your child with after having a quite big surgery with tapes and dressings and bit discomfort and not very easy to lift and things like that. So that is a big thing to take into account as well. And so for those two reasons combined, I normally say a year is better. A year your child started walking, maybe things are getting a bit easier, and also you're giving your breasts more of a chance to settle in terms of the shape and the size. So I think a year is best to wait before having breast surgery after having a baby. 6 months, I would say, is the minimum, and a year is probably better, all things considered, both in terms of your breast recovering and also in terms of your child being a bit more mobile and a bit easier to deal with. You could say the child's heavier, but it's a bit easier to deal with because maybe he started walking. He/she has started walking. Did it? Did it? The guinea pigs didn't put me off. My mum phoning didn't put me off. Went through it. Better phone my mum back now. Unless you've got any questions, feel free to bang it out there, because I'm here and now and I'm open and available. But if they're in the absence of questions, I'm going to sign myself off, and I will see you next Tuesday, 7 o'clock. Fantastic questions tonight. Can we better that next week? I don't know. I really don't, because there were some belters there tonight. And so hopefully we'll get some good questions for next week, and hope to see you there. Thanks for listening and viewing and being here, and have a lovely, lovely rest of the evening. And see you next Tuesday, here and now, 7 o'clock. Good night.